So you can register onto the website via your phone or also using the computer. So this is a combination of the two. So we need you to register so you can be found. So you can see there's some details, a bit more details here that are written. But basically you go to this section and you put your name in, your email, your contact email, and your phone number, and as you can see there, your WhatsApp number and your registration number. So these are all important things because that's how people are going to contact you. You know, unless you're working from home, which I very much doubt, you can skip the practice address. But you want to really put in the postcode because that's how people will find you if you're offering a mobile service. So as you can see there, it says professional role. And so what I've done there is you can see, oh, there's something that shouldn't be there. But basically, as a nurse or a dentist, hygienist, therapist, then that's what you put down. So for argument's sake, let's say you're a dental nurse. And then what are the services you offer? Well, there's the one here that I think you should be doing is teledentistry. So you can tick that box. You might provide a mobile service. So you might be going to care homes, which I'm trying to encourage. Or you can give advice over the phone about general oral health advice. You may have some qualification for dietary advice. You may have done specialist trainings and hopefully you'll be able to go around schools and apply SDF, and you can be able to do that synchronously under the guidance of a dentist, possibly. And yes, I think we should be using silver diamond fluoride a lot more, and we should be using cameras a lot more. And at the moment, unless the GDC mess it up, you'll be able to scan in the mouth. And that just needs a little bit of, you need the consent clearly. And yeah, this is a DAF law about needing the advice from a dentist to have x-rays taken on prescription. As a dental nurse, you just need to ask the patient when they last had x-rays done and do they want them taken to help with the assessment, which hopefully soon will be able to be done on AI. The rest are things you can't do, but a hygienist can. And the hygienist can also take impressions. I'm not 100% sure about nurses at the moment because it'd be brilliant if you could do a reline in care homes. Anyway, that's how it works. And clearly then you just put in your password. But you do need some files. So you need to, in this section at the moment, you need to take a photo or a scan of your GDC registration and your qualifications. So if you're saying that you are able to, for instance, give oral health advice, then you need some form of certification that the user can look up, because it'll be their responsibility and your responsibility when you engage in a contract. So I hope that helps. Right, so to join your files to the part you've already made already, this is how you do it. And this is for a nurse who lives in Downing Street. So what you do is you go further down the section, and where it says browse, that's where you add the files. So this is on the computer, so I stored mine on the computer, but you have to have them under 2 meg, which you nearly said there, and you add them all in one go. You can't add them one at a time, but then you just press register and it'll clear the screen. So to see what it looks like, I've put myself in Amlwch, and there you can view the documents that I've made in Amlwch. Look up the spelling, and so there's a bit about me, the bio, the qualifications should be up there, the services that I'm offering are there, price, how you do it, and how you get in touch, and a page where you can promote whatever you'd like to promote. So that's me, and there's Donald, and there's his services there. There is a slight issue here in that you can't really change your registration at the moment, but I'm working on it. I'll do it when I get back from a holiday.